Hi, Tanya.
Hi, Sue. How are you today?
Good. I didn't let the people in because I wasn't sure whether
Oh, no,
to or
no.
not.
We'll leave it. Yeah. I've just realized it always does this. It logs me in as ACU International. I'm just going to have to leave and come back as Tanya. I'll be a
Oh,
second.
mhm. I'll share the screen in the meantime.
Sorry. Perfect. Oh, and you shared your screen. Perfect.
Yep. Oh, good. So you can see that?
Yes. Yeah, that's wonderful. That's exactly what we want. Now, who is in the reading room? Anyone? Yeah, no, these are all. Oh, actually, I'll admit Louise.
Okay, I'll just grab a drink of water.
Yeah, sure. Oh, hi, Louise.
Good afternoon.
How are you today?
I'm fine, thank you. What about you?
Yeah. I've actually had like quite a busy day today.
All right.
which is quite nice.
That's
normally,
good.
normally it's just like an even kind of flow of work, but yeah, I've actually had
I
lots of
see.
stuff.
Hi, Louise.
All good? We'll just wait
Yes. Oh, I'm just checking. I hope this is the one I revised. I'll just double check that.
Oh, yeah.
Should be.
We have quite a few people waiting. That's good.
Yeah.
for you. Oh, there's the hospital. That's the one you revised.
Okay, yeah, that's a quick way of finding out.
This will be here soon. What have we got here? Wonderful.
How's the weather in Brisbane today, Sue?
It's a bit cold, actually.
I bet it's not as cold as Melbourne.
Oh,
Yeah,
probably, no, probably not. I'll have a look and see what it is. So, yeah. I usually have it coming up straight away.
So, the banner. One thing left.
22.
Oh, that's how beautiful. I'm coming to Brisbane.
I think I checked it this morning in Manly. It was like 11.
Oh, it was 2. Felt like 2 when at dawn this morning. It was 4, but felt like 2.
Oh gosh.
My cats they went to the back door and went, yeah.
No.
Turned around and came back in and put their nose on the heating. So they haven't moved all day.
Oh, that's funny. What is it? Oh no, Manly's just gotten up to 14. So
Oh,
14.2. Yay.
great.
It's quite cold for Sydney.
Yeah, I think because it's the shortest day of the year on Sunday. So
yeah.
Oh, that's right. The winter solstice.
The winter solstice, yeah. So
it's warmer in Melbourne than it is in Manly. It's 17.
Oh, what?
Uh-huh.
Yeah, no.
But it feels like 12.
Oh gosh. I don't know where. Oh, we've still got many minutes to go. But yeah. Anyone got any nice plans this weekend?
Yeah.
Yeah.
I'm going to the country to meet some friends for lunch and
Oh, are you?
yeah, to a little town called Dalesford. It's about an hour out of Melbourne.
Oh, Dalesford, that's beautiful. Yeah, I've got friends at Bendigo and it's not too far from there. Yeah. I like Bendigo too.
Yeah.
Yeah.
Yeah, Dalesford. And my friend owns a pub there, so we'll go and see.
That's the best type of friend to have.
So that, and I don't know, I've got to do a virtual fair on Saturday for Nepal, so I'll be working on Saturday. And, never mind, that's life. And but I'm not working tomorrow. There's Liz. Hi, Liz.
Oh, I can hear a cat meowing.
Yeah, that's Luigi.
Is that it? Is it Luigi?
There's Luigi. Oh, hello. I'll turn my camera off. Oh, what are you? Oh, Muddy. Thanks, Luigi. Get off.
Change my background.
Get down.
Where's my
Oh.
background gone?
Okay. Oh, now I'm all muddy.
Oh, no.
Liz is looking very concerned.
I think a background isn't working or something.
No, I can't get my background to work. Oh, get down.
Oh, really?
No. But that's all right. I'm turning my camera off.
Social background.
I can't get it to work in Zoom. I can get it to work in Teams, but not Zoom.
Same
Not
with
from-
me.
I can,
Mm.
from the stop video,
No, you've got to have a green room or something.
because I'm getting, oh, this is my one.
No.
Yeah, no, I can't.
Oh,
I can't.
the Brady Bunch.
The radio, if I kind of just like skidge in there.
That's
the other one
good.
I have. Unless they've changed.
Yeah, so Liz, you did it easily yesterday.
Hmm.
Yeah, I've lost the function. It's just gone.
That's it. If you know your stop video, the little,
Oh, that's
yeah,
nice.
there we go. Yeah,
I'd like to be there.
very much so.
Right now, let me just check. I definitely have. Let me just check that I have. Am I in as host, Tanya?
Yes, you should be. Yeah, I think it's hosts because Sue and I are as co-hosts. Whoever joins first automatically becomes the host for some reason. Like we all have the
Oh,
same
okay.
It
functionality.
says you're the host now.
Yeah, now you're the host.
Okay, great. Does everybody else still have host capability?
I think so. Yeah.
Except Louise
No, not me.
doesn't.
That's okay.
Can you still see the shared screen?
Yes.
Mm-hmm.
Stop video.
All right. Oh, why is that done that? Oh, you've got to love technology. 1 minute it works, and the
Yes.
next minute it doesn't. There we go. It's back again. Good. Okay.
That's what we want. Good. People are joining. Cool.
So, Tanya, do you want to run the waiting room, or do you want me to run the waiting room?
You can run the waiting room if you want, if it's easy, especially when you're like introducing and talking and
Yeah,
everything.
that would be
Yeah.
great. That would be great. Thank you.
That much easier.
I quite like my background.
I like it
Yes.
too.
I'm dreaming.
I'm
of
dreaming of
a
it.
tropical
Mhm.
island where it's nice and warm and yeah.
Yeah, well, it's nice to dream.
Yeah.
We just need those borders open and we can go there.
It's like-
Indeed, indeed.
I was having this conversation with some friends the other day. It was like as soon as the border restrictions, about 75% of us were like, we are booking a flight somewhere straight away. And the other 25 were like, oh no, we think it's too soon. Like we're going to wait probably another year just in case.
Oh, no.
I think I'm one of those straight away people. Okay.
How many did we have registered for today, Tanya?
I think, when I checked it yesterday, it said 10, I think it was 104, 105. I wasn't in there this morning. I won't log in because then it will make me, it always switches me. I feel like they're always a little late.
True, true.
Yes. IST. It's called Indian Stretchable Time.
To be
I
fair,
haven't heard of that before.
It's not. I didn't make it up. It's them.
to be fair, I live by that too.
Oh, must be the sheets. Oh, Pat. There you going to just get rid of my camera and mute myself. See you ladies.
I shall also do the same. All the best, Sue and Liz. I'm sure it'll be great.
Okay, Tanya, do you want to admit everybody?
Has she muted? Maybe she's muted.
No, we're just letting everybody in. Okay, good afternoon, everybody, and welcome to our latest ACU International live webinar, which is this afternoon on the Master of Leadership and Management in Healthcare. I'm Liz Griffin. I'm the Associate Director for International Marketing and Recruitment. And as you can tell by my background, I am dreaming of a tropical, warm island somewhere. So I thought I'd share that with you this afternoon. Unfortunately, I'm not on a warm tropical island. I'm here in Sydney, but a very warm welcome to everyone wherever you are. Before I welcome our speaker for this afternoon, just a few housekeeping messages. As usual, we've muted all participants on entry. If that doesn't work, please do mute yourself, but obviously we do welcome questions. So please feel free to add your questions into the chat box, and we'll cover these at the end of the session. The session is being recorded, and we'll circulate this and the slides after the session, so you have those for future reference. And there will be a poll at the end of the session, so please do help us make these sessions better. Let us know what you think, and we can feed that into any future webinars that we do. So without further ado, I am delighted to introduce Dr. Sue Gledhill. And Sue is a registered nurse, a registered midwife, and an academic. Her current position is the Senior Lecturer and Postgraduate Course Coordinator in the School of Nursing, Midwifery and Paramedicine at ACU. Sue's based up in our Brisbane campus, so I don't know, maybe it is warm where you are, Sue.
20 degrees.
Oh, beautiful, where she has responsibility for postgraduate course coordination of the Master of Leadership and Management in Healthcare. And Sue's going to give us an overview to that programme this afternoon. And like I say, please do add all of your questions to the chat box and we'll get to those at the end. Over to you, Sue.
Thank you very much, Liz, for that very warm welcome. And welcome, everybody, and I hope you enjoy the session. So, as Liz was saying, I'm the postgraduate course coordinator for the Master of Leadership and Management in Healthcare, which is a new course. It was only commenced last year, so it's fresh off the cab rank, if you like. And if you, as you can see from the slides, I've got a picture of all of the different campuses because, as you probably know, we're a national university, and I'm located in the Brisbane one up the top, which was an old monastery in the past, but there's a picture of all of the campuses because our students could be anywhere, or our lecturers could be anywhere. And so it's a good idea just to have a bit of an idea of what the campuses look like. The course aim. So the course was developed in response to international feedback and the need for a course focusing on management in healthcare that better managed or better responded to international students' needs in terms of learning. And what we're doing is we're aiming to prepare graduates to become ethical, effective health leaders and managers who support innovation and who are able to take the lead in strategic development of a range of organisations, leading to culturally safe, resource-efficient healthcare within local, national and global health contexts. So coming back to that ethical, effective health leader and manager, we have a very strong ethical underpinning throughout the units, and ethical care is something that we really promote, and we're looking at that very carefully. And same with innovation. We're looking at leaders now who can be innovative and who can develop new ways of providing healthcare. So some of the unit assessments are around creating, designing, or generating. So it's not just about taking what is, but looking to ways of improving what is and to what could be. So we do very much focus on that innovative aspect as well. Career pathways. So graduates who complete the Master of Leadership and Management in Healthcare will be well equipped to lead and manage a range of healthcare services from a local, national and global perspective. So a lot of our unit content, we focus of course on the Australian healthcare environment, but we also look at what's happening across the world as well, and also across the nation, because in Australia we have a very unusual way in that we have states and territories which have considerable power, but we also have the overarching federal government as well. So things can operate quite differently between states and jurisdictions and territories. So potential roles include a health services manager, a nurse unit manager, a leader or a manager or a chief executive officer in a health facility or a health organisation, a leader or a manager in a humanitarian or social welfare organisation, manager of a public or a private health-related facility, or employment in a humanitarian organisation, for example, in the World Health Organisation or other social welfare organisations. So the course provides a solid foundation for graduates who wish to pursue further study in the health industry. Just looking at the differences between the Master of Leadership and Management in Healthcare, the Master of Health Administration and the Master of Public Health. So as you can see, the Master of Leadership and Management in Healthcare, it has a 2-year duration and 160 credit points. It is a master's unit only, so it doesn't have a grad cert or a graduate certificate or a graduate diploma built into it, but we do have course rules such that a student, we understand that students might want to leave for various reasons, so we have built in exit points at grad cert and grad dip level. So students aren't committed to the whole masters. If they want to leave after they've successfully completed the units required for a graduate certificate or a graduate diploma, they can do so. The course has greater depth and knowledge perhaps than and skill content than the Master of Health Administration, which is a lesser duration of 1.5, 120 credit points, and that does have the nested structure of the graduate dip and graduate certificate. In the Master of Health Administration, there is an option for a project stream or a research stream. Now, we didn't put that into the Master of Leadership and Management in Healthcare. Because our feedback from students was that the major project, more students were doing the major project, very few were going on to do the dissertation in the Master of Health Administration. So when we developed this course, we decided to just keep it with the independent project. And we found that's been, in just the 1.5 years it's been running, it's been a very good decision because students are really creating very good projects and making a significant contribution to healthcare. With the Master of Leadership and Management in Healthcare, the career potential is for middle, senior, executive level service leader or manager. And as I said before, a social welfare or humanitarian management or leadership and health policy development, among others. And then the Master of Public Health, as you can see, that's a 2-year duration. Still, it's the same as the Master of Leadership and Management in Healthcare with 160 credit points. There is a GPA requirement which the Master of Leadership and Management doesn't have. And the career potential is slightly different. Obviously, public health has a public health focus, and so graduates can look at managerial, analytical and program or project-based roles in public or the not-for-profit sector, such as epidemiologists, population health, consumer advocacy, for example. So there's a range of different career pathways depending on which course students enrol into. The course has a focus, the Master of Leadership and Management in Healthcare course has a focus on leadership, quality and safety in healthcare, very strong focus on that. So students who enrol in the course will have a very good knowledge of the Australian healthcare system and also national safety and quality standards, for example. We also look at organisational governance, collaboration across political, social, economic and cultural dimensions of healthcare, And we also include financial management too. That is another point of difference from the Master of Health Administration. We have built in a financial based unit as well. And just going back to collaboration, of course, as we all know, we don't operate in silos now. We need to have very strong collaborative skills in healthcare, as in most industries. Students who enrol in the course will be supported to develop a knowledge and a suite of skills that can be applied in leading and managing health services across a range of health settings. And graduates of the course will be particularly well equipped to advocate on behalf of disadvantaged groups for better access to and delivery of health services. And so we look at, the students have opportunities to focus on a disadvantaged group of their choice. I find a lot of the international students are very interested in looking at the access to health and the health services available to rural and remote Aboriginal and Torres Strait Islander population. I'm not sure if you're aware, but they do have a significant lower life expectancy and poorer health status overall in general. So that's an area. But we also look at refugees and migrants and other disadvantaged groups, older people, the older population, for example. A career in healthcare leadership and management means that graduates will have opportunity to make a real difference to the health and social welfare of the individual, the organisation and the community. And I'll come back to that independent project that they do towards the end of the course, and that's where that can happen, apart from the learning as well. So opportunities. Contemporary healthcare is delivered in a range of increasingly complex settings which require effective leadership and competent management. Now, I'm sure you will all agree with me that nowhere has that become more evident than during this COVID crisis. So we have, unfortunately, in a way, that we do have an excellent opportunity to sit back and observe the leadership and management that's currently taking place in relation to response to COVID. And we can learn from that too. And this might help shape, revisions of our units as well. But it's certainly good to have that bird's eye view in a way of what's happening and in terms of leadership and management in healthcare right at this very moment. We also look at the increase, we know about the increased workforce mobility. People are moving around the world, healthcare workers particularly, coming to developed countries like Australia and less developed countries, going the other way to help and set up different healthcare facilities. And I have a little story at the end, if I have time for that, to share that experience. And looking at, we look at national and global, as I said, healthcare environment, because you can't just be very focused on your own locality. You really need to take that broader view, and we do that. Healthcare leaders and managers also need to have a good understanding of regulatory requirements. For example, accreditation. Now, most healthcare facilities in Australia have to undergo an accreditation process to be able to demonstrate that they have quality, they can deliver quality care. And so students in the course learn a lot about accreditation process and how to lead an organisation through accreditation. We look at health practitioner regulation, human resource management, and also policy. And that's one of a good unit, and I'll talk about that one a little bit later on, where students have an opportunity to compare policies and develop their own draft policy as well. There are complex funding arrangements. As I alluded to before, in Australia we have a very complex healthcare environment because we have federal funding for healthcare, largely federal funding, but the operational side of health services is usually comes back to the states and territories to actually operationalise healthcare. So there is that complexity there. And as well as that, we have the public and private health insurance. So it's quite a complex system. And I always think that if students understand the Australian healthcare system, which they will do by the time they complete the course, they'll have a good understanding of how healthcare works in any nation, I think. There's also a lot of changing demands on leaders and managers in the future. We know that we need to lead teams towards alignment with organisational goals. We need to support strategic development, collaborate across continuums of care in a variety of healthcare settings, and integrated healthcare delivery, where you have that transition from the community into perhaps an acute setting, and then rehabilitation and back out into the community. So those processes are all being streamlined now in the Australian healthcare setting and in other settings as well, in other nations too. So that's an important part of the way we deliver health service and learn about how to deliver and lead and manage. We also need to know how to manage budgets and to identify resource implications, because as we know with healthcare, there's always a competition. There's like competing resources. So do we get the, the new latest whiz-bang technology, or do we provide more basic care to a greater number of people? So there's always those ethical and cost efficiency types of decision-making around healthcare. And so students who do the course will develop those skills very well. The course is offered in North Sydney in mixed mode for international students, and it's 2 years full-time or equivalent part-time, of 160 credit points, as I mentioned before, and no nested structure. But those exit points that I talked about earlier, the student, because there isn't a graduate certificate in the Leadership and Management Healthcare course, the students who choose to exit at graduate certificate level or graduate diploma level will exit with a graduate certificate in health administration or a graduate diploma in health administration, not leadership and management. They can always come back and complete the course, and we've also built into the rules that if they have undertaken or exited with a graduate diploma, say, for example, or a grad cert, then they can, they'll be fully credited towards completing their masters at a later date. The course is aimed at graduates of a variety of relevant undergraduate degree, so they don't necessarily have to be health practitioners. If they're working in human services or some other related or service, then they'll be eligible to enrol into the course. The other thing that we gave a lot of consideration to was whether or not to require previous professional experience and before being admitted to the course. And we decided not to do that. We felt that a lot of health practitioners are keen to go straight on. Not all health practitioners can get a employment as soon as they finished their undergraduate qualification. And so we decided to enable students to continue on. And of course, we are very mindful of that in the unit development, making sure that we have content that is applicable to both new graduates and people who have been working in a health-related field for quite some time. And one of the benefits of the units in this course is that almost all of them have opportunity for either in-class discussion, debate, collaboration, and certainly for the online units, they do that too. There's a lot of opportunities for engagement and discussion with peers. The feedback from students is they get a lot out of that. They really enjoy those online discussions or the class discussions. So it's an important part of the curriculum. So to be eligible, as I said, the student or an applicant must have the equivalent of an Australian bachelor's degree in a health or human services related discipline, or the equivalent of an Australian graduate certificate or graduate diploma in health administration, or the equivalent of an Australian bachelor's degree in any discipline and relevant work experience in a health or human services role. In addition to meeting the admission requirements, applicants must have an overall academic IELTS of 6.5 with an individual score of 6 in writing, speaking, listening and reading. Now, since the course was developed and offered, we have now had approval for admission into the Master of Leadership and Management in Healthcare to be via a Bachelor of Ayurvedic Medicine and Surgery. So that's now an approved pathway for entry. And that was in response to industry feedback as well. The course structure. So here's a course map. And as you will see, year one, semester one, a student would normally enrol into the 4 units of organisational culture and management, quality and safety in healthcare, policy and planning in healthcare, and interpreting health research. I talked a little bit about quality and safety, largely being based on the National Australian Quality and Safety Healthcare Standards, And I mentioned that students would have a very good knowledge of that. And also with organisational culture and management, it's very important, as you know, as a leader or a manager, to be able to understand or read the culture and to be able to guide the culture of an organisation, because it has a very big impact on the quality of healthcare services, for example. The policy and planning unit is, I think, quite a good unit, because students, as I said before, they have the opportunity to review different policies and to develop their own policy, and they might compare policies around it from their country of origin with Australian policies, and they might even develop a draft policy that would suit their own country. For example, I had a student who had identified the issue of being as a health practitioner. He worked out in rural and remote India, and they ran out of resources, and so that was a problem, and that he'd identified, and so he wasn't sure what type of a policy, how he would develop a policy or a draft policy. So I suggested that he develop a draft policy around the situation in India with the resources, and how resources might be better planned for in the future. And, I hope that he might be able to go back, and because in the end, he developed a very good policy, and hopefully he might be able to go and present that to his regional person, in charge. So, this is where, although this is a theoretical course, a lot of it has very practical application, and that's one of the things that we do promote, to make sure students not only have the knowledge, but also the skills to do as well, to do and act. Interpreting health research is all about the literature and looking at the literature around a topic. So in that unit, they identify a problem, and this is where they might be able to build on that in the independent project in their last semester. So those are the first 4 units. And then in semester 2, or the first year, students will do leadership in healthcare. Again, I get a lot of positive feedback about this unit, and one of the main themes coming through from student feedback is that they say, I've learned so much about myself. And I think that's terrific. It's wonderful that they're learning. I don't think that you can lead others unless you can lead yourself. And so that is the feedback. They're getting a good understanding of how they tick, and that will help them to lead others as well. Workforce management is quite a practical unit. Still, they're all theoretical, but still very practical. So there might be role plays around recruitment and selection into a position. We look at the laws, the legislation in Australia around work. So, for example, Fair Work Australia, and we have a look at what that means. And so that's another good unit. Elective, students can have, there's 2 electives, as you can see. So there's opportunities there, and I'll talk about electives a little bit further. I find they often look for a research unit, and there are 2. They can do either a qualitative or a quantitative research unit. And that also provides really good grounding, building on the interpreting health research unit and working towards that independent project towards the end. And then healthcare ethics. Now, as I said before, ethics is a very strong theme, not just doing that one unit, but a lot of the units, for example, in quality and safety in healthcare. Some of the assessment tasks might be around what an ethical leader would do in that situation, or organisational culture. How would you ethically manage your workforce? Or, those are the sorts of things. So we have a strong ethical theme running through all the units, but there is that standalone unit as well. Getting up to semester in year 2, we're looking at a little higher level management. And so we're looking here in the first unit at strategic management. So, and really a lot of that is around decision making, how to make good decisions in relation to resources, staffing, and healthcare delivery in general. So that's a really good unit. And money management too. This is where we built in financial management. Now, one unit isn't going to give you a whole lot of. You're not going to be an accountant from doing one unit, but any kind of leader or manager in a health environment needs to have a little bit of an idea about how finances work and resource allocation, financial resource allocation. So that unit answers that for them. And so that's in there. And then facilitative leadership, coaching and mentoring. This was a unit developed in response to domestic industry feedback, where they said, we really need strong leadership and mentoring. Mentoring is really topical, good mentorship programs. And so that that unit builds on that aspect of healthcare delivery, being able to be a facilitative leader, coach and mentor in health services. And then again, the final unit in that semester would be another elective. So there's a lot of flexibility and choice there for students. In year 2, the last semester, students will do leading change in health services, and obviously, as the name implies, it's all around change management. And we know that things are never static, particularly in healthcare. There's always changes going on. And so how do we lead those changes? What are the things that we need to consider? There's a little bit of disaster management in there, because as we all know, things are happening right across the world, and we need to have the principles to be able to apply them in different situations. So, like, for example, in Australia with the fires, and or it might be a tsunami in another nation. Well, we can't give detailed step-by-step instruction of how to manage those, but certainly this unit provides those overarching principles about what to do first. What's the first thing you need to think of when there's a disaster or a emergent crisis, and that will equip students to be able to respond without having to think, what do I do? What do I do? They'll have those skills and knowledge that can apply across a variety of different crises. Redesign in health service. This was another unit that was developed in response to domestic industry, saying, well, there's always changes. We're always building new facilities, or we're tearing down old ones, or we're restructuring a ward or a unit or a facility. So consequently, we developed the redesign in health service, which has a lot of lean thinking in it, and also process flow. How does, what happens from the time a patient arrives in the emergency room and until they are discharged, and how does that, what are the obstacles or the barriers to a smooth process there? So we have a look at that in redesign. And then the independent project. Now, this is a 20 credit point project, and it's been very rewarding. We're seeing really good projects generated from students. And of course, they're not working. International students are usually not working in a healthcare environment while they're here. Some are. But so we develop projects that are doable for them. And so it might be about developing an educational package for staff or for patients, and from an area of health that they're more familiar with. And that could be from a family member who has a particular condition. They can develop policy, expand on the policy they've developed or the draft policy they've developed in 607, the unit 607. So we're always looking, we really promote constructive learning. So we don't want students to have to, reinvent the wheel every time they do a different unit. We're looking at ways of building on what they've already done. And the reading, they've already done the reading around, if they've done the reading around a topic, how to build on that. So they've already got that good solid knowledge and background in their head, and then they can just build the project on that. It could be an audit tool. They can develop, or an integrated literature review. There's a whole lot of different mechanisms. And in that unit, students are mentored one-on-one. So, and they find that very rewarding. They have that close relationship with their supervisor, and it's very rewarding. And a lot of flexibility about how they meet and how often as well. And just a conceptual framework. I'm a bit of a qualitative person, so when I was developing the unit, I looked at the concept of at graduate certificate level about understanding self, and that goes back to what I was saying before about that leadership unit. How can you help learn about other people or be able to lead or manage other people if you don't have a good understanding of yourself, and as a leader and a manager? And then a graduate diploma, building on that, having a look at self in relation to others. How do we manage others? How do we respond to others, and what do we do? And then at master's level, looking at self in relation to society and the contribution to the social good. So particularly with that project unit, what can we do here that will benefit, that will make an improvement in the way that health services are delivered or in knowledge around health service. So that was the conceptual framework upon which the course is built. Some of the learning outcomes, it's around acquiring knowledge of contemporary leadership and management strategies in healthcare, appraising leadership and management models from a local and international healthcare context, analysing challenges and barriers and enablers. It's all very well. We can't just present a wonderful view of healthcare. We need to have a look at what are the challenges and how do we manage those? What are the barriers and what are the enablers? How can we build on those enablers and make the world a better place for people who require health services? And again, that comes back to the common good. And also there is a big focus now on corporate social responsibility. So we have a look at that as well. We built that in too. And I probably didn't say this with the other unit that I talked about, but also employee wellbeing. How can we look after our best resource, our most important resource, which is people? And so there's a bigger focus in industry and that we've taken on board in developing the curriculum, that a greater focus on employee wellbeing as well. And then learning outcome 4 is about applying an ethical and evidence-based approach to lead and manage across those range of different healthcare settings. So that's where we have that interpreting health research and ability to do further research units as well. So the course might appeal to people who are allied health disciplines, and we have a smattering of physiotherapists, social workers, as well as, of course, the majority are nurses, but we also usually, and always, well, pretty much always have dentists or doctors, and usually a couple of dentists as well. And social scientists too, we have usually enrolling into the course. Pharmacists, medical scientists, as I said, and radiation specialists. We've had a few of those lately. The other thing we're trying to, if you're leading and managing, your skills that you develop in this unit should be transferable to other industry. So we're looking at broad concepts as well as the detail. As I say, a good leader or a good manager should be able to lead and manage effectively in any environment if they have those solid foundational skills. And this is just an overview of some of the electives. Now, students can choose from these and a few other electives, but if they don't like the electives they see, then they can enrol on a cross-faculty basis. So I find that students who aren't too interested in the ones that the health faculty of health offers, they'll go to and they're supported to do that, the Faculty of Business or the Faculty of Education, and have a look at the units that are offered there, and they can enrol into one of those on a cross-faculty basis. Now, if they're still not too keen or none of them appeal, they can enrol into a cross-institutional unit, and we support that too. So there's a lot of flexibility, a lot of learning opportunities for students in the course. Just to final, just before I think this is a final slide, modes of learning. So as you might be aware, we've had to go to fully online in semester 1, but the university is very aware of how important that face-to-face, that connection is with international students. And so next semester, we'll be all back on campus in North Sydney for the face-to-face units. And the current students are very relieved about that. We've had that, we know that they've been told already that they'll be back on campus, and they've all said how good that is. And so they usually enrol into a mixed mode because all the content is also online, so they have the opportunity to have a look at the online as well. 1/3 units are online, and so students don't, that complies with their immigration visa requirements as well. So they can do online learning as well. And then that independent project, as I said, it's one-on-one with a mentor supervisor, and that's a very rewarding. I've been teaching into that unit for quite a while. I'm not the lecturer in charge, but I've just had 3 students complete their projects, and I think it's very rewarding for me, and I think they've enjoyed it too. So and they've developed some excellent projects. So it's a really good unit. And I just wanted to, I remember earlier I said I had a little bit of a story. Now, this course has only been going since the beginning of last year. And prior to that, I was a coordinator of the Master of Health Administration course. And the first 80 credit points of the unit are the same in the Master of Health Admin and the Master of Leadership and Management. And that's what's enabled us to be able to provide those exit points for students. But one of the students who was in the Master of Health Administration and has just, I've kept in touch with, he's from Iraq, and and his wife were here and completed the Master of Health Admin, and they've just emailed me recently to say that he has been instrumental in helping set up this brand new hospital in Iraq. It's called Maria Mana. And so that was on the basis of doing the Master of Health Administration, but it would be the same for the Master of Leadership and Management in Healthcare. So he went back and then helped set up this brand new hospital. So to hear that is so wonderful. I just think it's only just opened in June, so it's just terrific. And that's my final slide. So I guess the floor will be opened up now for questions.
Thanks, Sue. That was a really comprehensive view of the programme. And I think what strikes me is that this really sort of complements the rest of the portfolio of programmes that we have, particularly related to nursing and healthcare management as well. And I think for our students, particularly if they are from a medical or a nursing background, I think it's great to see the professional units that are in there around business management and leadership and mentoring, because I think that's really not necessarily sometimes an aspect that we think of around healthcare. We think of nursing and we think of those programs, but I think this offers students a real career progression point and a point of difference when they do go into the healthcare sector. So I think that's really interesting. We haven't got any questions in the chat box yet, so if anyone has any questions, feel free to pop them in there. And I guess I just wanted a question to set this off. How has the programme been received so far by the sector? Are these skills that the healthcare sector in Australia and overseas, are these skills that are needed at the moment?
Oh yes they are. Well, the course itself was really set up or generated from international feedback, education agent feedback, for the need for that 160 credit point 2-year course, and industry, domestic industry had already identified that they needed a strong leadership course as well, and so we involved domestic industry in some of the units. So we put out asked for what type of units, what type of content was needed, and that was where we received information or a request about the facilitative leadership, coaching and mentoring, and the redesign in healthcare. Now, I probably wouldn't have thought about redesign in healthcare as being a part of that, because it can be a whole course on its own. So we certainly do listen. I went on a roadshow 2 years ago in Queensland and with a colleague, and talked to industry to find out what their needs were. And yes, a lot of content did stem from that. And we involved them in the course review, having a look at that, reviewing the content before it was, went through faculty board and was finalised. So there has been a lot of external feedback and support.
And I think that's a key feature of all of our programs here at ACU, is that when we review a program, we go out to industry and we go out to alumni and we ask them, what is it that you need? So if you're working in healthcare, what is it that you need in our graduates? So that we can make sure all of the programs are extremely relevant in delivering what the sector wants.
That's right. It'll be very interesting to see if we did another roadshow in a year or so, what is there anything different stemming from the COVID situation? You know, what are the shortfalls in the way we deliver health services? And yeah, it'd be interesting to see that.
And we had a webinar on the Master of Public Health, and actually they were one of the first webinars that we did back in early April, when COVID hit, and that was really interesting to see the intersection between, I guess, what we see as a degree program, but actually the real life application of the public health program. It was really interesting. So we haven't got any other questions at the moment. So I am going to say a huge thank you for your time, Sue, this afternoon. And
Thanks,
as always, we've got our regional managers available if there's any questions that come after this, or indeed, you know, I'm sure that we can certainly ask Sue to step in and provide any further detail when needed. So
yes.
Thank you so much for that, Sue. We really appreciate your time this afternoon. I am going to launch our poll. So obviously these results you'll see live. So if you do have a moment just to give us some feedback on that poll, and just let us know really how this afternoon, how useful that's been, and you know, if there's any other topics that you think you might see or would like to see in the future. So I am going to wave you goodbye from my tropical island here in Sydney, and wish you all a very safe and happy time until our next webinar, which is next week. So thank you, everyone. Have a good afternoon.
Thanks, Liz.
Wonderful. Thank you so much for today, Sue. That was wonderful.
Oh, that's good. I'm just looking at very much for hosting and facilitating this as well.
That's been great.
All right, I'll head out. Shall I end now?
Yeah, you can end and leave, and we'll just
okay.
we'll wait
Thanks
till the
very
poll.
much.
That's all right.
All
You have
right.
a great afternoon. Enjoy your weekend.
Thank you.
Wonderful.